Fentanyl, common trade name is Sublimase, but again, widely available as a generic. One of my favorite drugs. It is an opioid analgesic, Schedule II narcotic. It's a very good painkiller for our patients. Mechanism of action, it binds to opiate pain receptors, producing analgesia and euphoria. Has pregnancy class of C. Indications, pain management, anesthesia. You can sedate patients with it at a very high dose. Some contraindications would be respiratory depression and severe hypotension. Adverse reactions that might be associated with it: respiratory depression, CNS depression, delirium, nausea, vomiting, paradoxical excitation, it's pretty rare. And then if given at very high doses and administered very rapidly, you can have a rigid chest wall syndrome. But again, as long as you're pushing it like you're supposed to, slow push, and watching your dosages, then shouldn't have any issues with that rigid chest wall. I like it. It's a very good drug. Works very well for pretty much any type of pain. Has relatively mild side effects compared to morphine or ketamine, something like that. So that's why it's my go-to painkiller for patients. Drug interactions, synergistic with other CNS depressants. Adult dosing, typical 1 microgram per kilogram, IV, IO, IM, IN, ET tube, whatever you want to give it. Typically you give 50 or 100 micrograms based on your protocol. For the kiddos, 1 to 2 micrograms per kilogram, IV, IO, IM. Onset starts working very quickly, 1 to 3 minutes. Peak effects in 3 to 5, and it lasts in the body up to an hour. I would say that's tops, but usually about 30 minutes. And that's why it's such a good EMS medication, because it lasts usually 30, 40 minutes, something like that, and then it wears off. So it's really good for the EMS side, unlike morphine that might stay in the system for several hours. Some special considerations, just something to keep in mind: it is a very potent drug, and so 100 micrograms of fentanyl equals about roughly 10 milligrams of morphine. So, you'll never see a 10 milligram vial, you should never see a 10 milligram vial of fentanyl, which would be just astronomical amounts. So it's all packaged separately to keep you safe on that end of it. But no, that is very potent.